Oh, hello and welcome to our first episode in November.
This week we meet Nand, a specialist in renal health. We meet Cecil, a justice of the peace, who will tell us some important information about organ donation. In our Cha food section, we visit a Turkish cafe to give you the perfect taste of Turkish hospitality. And finally, Neha will teach us a breathing exercise.
Renal failure is very hard to diagnose in the early stages of chronic renal failure. Mild to moderate renal failure doesn't even have symptoms. We spoke to Nand to know more about chronic renal failure and its symptoms.
Nand is a Fiji-born kidney specialist who has lived and worked in New Zealand for the past 23 years.
My main research area is in the field of nephrology, and I've been mainly focusing on diabetes and kidney disease. I've done a lot of research in my training years on kidney disease in the Maori and the Pacific people in New Zealand, and I've been quite focused on this particular field because not only do ethnic minority have a bad form of the disease, they do progress very quickly to end-stage renal failure requiring dialysis, and that's something that has puzzled me and actually bothered me, so I've been doing a lot of research on that field. My research area is also to see why this prevalence has increased in these people, and as you know, diabetes comes hand in hand with the kidney disease, and the prevalence of diabetes is rising. So that's the sort of research that I'm pursuing right now, and my goal is to look into ways that we can target the high-risk population and reduce this epidemic. Kidney disease is actually a public health problem, not just in New Zealand, all over the world, in developed and developing countries. And the burden of the disease is actually large and growing. And there are ways that we can prevent this. In New Zealand, like every other country, the prevalence of people with diabetes is increasing. The prevalence of disease with patients with kidney disease is increasing. And as you know, kidney disease, you probably won't know, but kidney disease is a silent killer. And people have no knowledge of the fact that they have kidney disease. And that is why it's important to screen high-risk people. And that is why there should be campaigns to increase public awareness and to screen people with simple, inexpensive tests which are available in any setting. The best way to keep your kidney healthy is, I would say, probably the preventative strategies are most important. If you're high risk, if you have diabetes, if you have high blood pressure, or you have a family history with significant history like this, then you should get yourself checked. Then lifestyle has a lack of proper lifestyle has direct link with chronic kidney disease, and it's lack of exercise, smoking, poor diet, excessive alcohol has direct links to kidney disease, and modifying your lifestyle would be something that is very important to get your kidney disease to prevent kidney disease coming on. I mean, there's campaigns out there to say drink more water and your kidney will be fine. These are all very well, but it's important to modify your lifestyle, and a healthy lifestyle is important to reduce your chances of getting chronic kidney disease.
In addition to working in Australia, New Zealand and Fiji, Khushma has also worked in Samoa.
Yes, my role in Samoa, I suppose you'd say that it was being at the right place at the right time, and having had experience with the Maori and Pacific people in New Zealand. I was approached by the Samoan government to come and look after the unit. You know that Samoa has a high prevalence of diabetes, and as I said before, diabetes and chronic kidney disease go hand in hand. and they also have a very high number of people on dialysis and with kidney problems. So I went there as a voluntary person to look after this unit, and Samoa, these patients actually from Samoa were dialyzing in New Zealand before, and the government was contracting the service from New Zealand, but now the government came to the party and has actually built up a unit there. But unfortunately the national health system cannot support this with specialists, so we've actually gone there as a voluntary organization helping them out, and it's been quite useful.
Hushma plans to continue her research in order to reduce the prevalence of kidney disease.
My future plan definitely is focused in research in nephrology, and nephrology means diseases of the kidney. My training years, I spent a lot of time researching ways and strategies to reduce the progression of chronic kidney disease to dialysis stage. As you know, dialysis is a pretty incapacitating condition where you're imprisoned to 3 times a week treatment on a machine, and I hope to develop ways to reduce that. I would like to develop a close relationship with my primary care colleagues, upskill them, upskill nurses, upskill people, and increase public awareness about kidney diseases.
On her path to becoming a successful doctor, Hushma had to work hard and make sacrifices in order to achieve her goals.
I had major family commitments because my partner was also in high medical field doing his specialist exams while I was doing it too, and I had to also have children and go on, and I focused, and I emphasized focus is the main thing, and I focused. I was determined to succeed, and I just slept less than I should have, and I went out less than I did. I probably sacrificed a little of my young years to do what I did, and I'm happy I did it, and nothing is impossible.
After the break, we speak about the importance of organ donation.